Dr. Jonas Apostol.
So hi guys, another week, another day, another month, and another case that I will be presenting to you. So this woman who is on her almost golden year went to my clinic with a chief complaint of having this unsatisfied appearance of her teeth and a little bit compromised, especially on the function and the health as well. So let's talk about the appearance of the teeth now in relation to the face. As you can see here, she's on her 50 and the collagen is starting to lose its numbers. That's why the upper lip, it's a little bit collapsing. Okay, so it's affecting the appearance of the upper teeth, especially the height. Okay, so in this particular case, I will do a modification on the length and the shade and the height of her teeth. The height is very important, especially in this particular design, because it will give her that youthful smile. And also the color of the teeth is very important because it will give her a glow to her face. Okay, so we're not talking about serious super white, but we are discussing about natural looking white teeth. So when we check the inside appearance of the teeth, as you can see here, she has an existing fixed bridge, which is a porcelain fused to metal, and it's kind of obvious, especially on the cervical area, which is a little bit darker. On the left side, you can see here it's a canine crossbite. Very intricate case, which we need to make sure that we will going to resolve that. Also, there's a missing adjacent tooth of the canine, and that is giving the patient a little bit of trouble, especially biting. So the reason why we change the porcelain fused to metal, it's because it's already old and it looks not so beautiful, not because that's really normal, especially if you're using it every day and it's really functional. That's why you have to have it replaced after more than 10 years or 5 years. It really depends on how you take care of it. But in the patient's case, we have to replace it because it's the totality of the health of the mouth. So before we touch the teeth or before we remove the old restoration or the bridge, we have to create the design first. Okay? In this case, I chose a P1 shade for the patient and I designed it directly in the patient's mouth to be able to gauge how it would look like, kung babagay ba sa face, and the color na sinasabi ko. So notice here that the design is a little bit whiter and we lengthen it. We added height and thickness and distributed it well, especially on the premolar area. Also, the patient was requested to give us a repose position so that we can be able to check the height of the teeth in relation to the lips in a relaxed position. So, kita natin dito, it's kinda give the patient a little bit of character because it's bigger and wider and whiter at the same time. So the patient had 4-unit fixed bridge before and we replaced it. Plus we added veneers and crowns to complete an 8-unit ceramics on the upper. So after removing the old fixed bridge. We cleaned it well. We remove all the unsound structure, and we put a lot of medicaments in there, like we are talking about the sensitizer, immediate dentin sealing, and with HEMA or hydroxyethyl methacrylate to be able to seal the dentin layer to avoid any bacterial invasion or leakage. So after preparing the tooth or the teeth, we were able to establish everything, especially we remove also yung mga calcular deposits inside the root of the teeth, not just on the upper and the prepared tooth, but also on the lower arch then. So we were able to clean everything. So before leaving our dental clinic, the patient will be wearing a temporary bridge and crowns to be able to protect the teeth and also to have the feel of the new design. So the patient will be waiting, will be wearing the provisionals or the temporary for 7 to 10 days. So while waiting, we are making the permanent ceramics. So in this case, we use a zirconia core, especially in the bridge, because we want to establish a very durable core. Also on the crowns and veneers, we also use a zirconia crown, plus we layered it with porcelain to make it look very, very natural. And also we have our own in-house dental laboratory with our own CAD/CAM machine to be able to ensure the quality of its ceramics that we are producing. So step by step, I'm always there to guide my team to be able to come up with the right material or the right result. So after a week,
1 week later,
the patient went back to my clinic for the Tryin of the ceramics. So before we placed in permanently or cemented, we need to make sure that everything should be perfectly fit. So a lot of process, we have a lot of steps in achieving this type of process. No? The cementation is very, very tedious. That's why it's technique sensitive, especially with the material that we are using. There is no room for error. Okay. So the patient agreed on the design and everything, all the characterization of the natural structure of the teeth incorporated in our ceramics, and yun, we cemented it. And also for this case, we placed in a gum like it's a porcelain that is color pink, which we emulate the color of the natural gum of the patient, so that it will blend properly. So the reason why we placed in a pink porcelain to be able to address the problem, especially on bone resorption. So pag nangyayari doon, there's a hole there na nakikita nyo that it would create some shadowing in the future. Even though we use the zirconia or all porcelain, it will not matter because of the shadowing. So ito yung pinaka-purpose talaga ni pink porcelain, to be able to mask and to blend well with the gums. That's why we copy not just the gums but also the color. So we place in very, very subtle addition of the pink porcelain, because we don't want to create something na it's hard to clean naman. So the patient could or should be able to clean this type of bridge. So we have like instructions naman on how to clean this properly. So this is the after na result. So the patient really requested for a whiter shade. Also, we are planning to do implant and veneers on the lower to be able to close the gaps, and we can also be able to mimic the color on the upper teeth, kasi that's the plan right there. So nauna lang muna tayo sa upper. So as you can see here, the lips enhanced tremendously because of the design that we made. This is just a week after the cementation, pero it has adapted well. After a few months, like 6 months, you will be able to see the real beauty and the adjustment of the lips, especially on the upper lip. Dito. So nakikita nyo dito, we were able to balance everything. The symmetry is on point. The color is perfect for the patient's skin tone. Also the serrations in there, it gives the patient a natural feel of the teeth, and at the same time it's bright, and the characterization of the design, especially on the canine, she has a well balanced with strong personality type of design for the patient. And this is an age reversal type of design, especially when you're getting older, you lose all the collagen, but yet this type of design will recalibrate your smile, will be able to give you a young looking appearance. So the patient is very, very happy with the result because of what we did. We addressed the aesthetics, we addressed the health of the gums, the teeth, the supporting structures, and also we addressed the function of her teeth. So there's a clear plan for her in the future, not just the upper, but we are also getting that lower teeth to be done as well in the near future. And I'm so excited for her and happy for the result. So as you can see, it looks great, but if you want to make your teeth to last, you have to take care of it, and you have to follow instructions and protocols in taking care of your bridges or ceramics. And also you have to visit your dentist, because there are a lot of issues that only the professional could be able to see and understand, especially those who made your own ceramics. So one of the most important weapon or tool in order to clean your bridge is, dito sponsored, no? Pero this is by far the best material. It's Oral-B Super Floss. Okay, that is a great material or great floss to be able to clean your bridges. So every case has a different design, so that is very, very important. It really depends on your case and face and everything. Okay, I will do an initial consultation, initial smile design before we start the procedure. So this is very, very predictable, and we always ensure that the health is on point. That's the first priority, and it should be functional, and it should be beautiful like an apostolified smile.